from Louisiana's home team. This is Fox 8 Morning Edition at 6 a.m.
Strokes actually kill more than 137,000 Americans every year. The good news, though, up to 80% of them can be prevented. And Dr. Meredith Maxwell joins us now with more on how you can recognize some early warning signs. And I mean, that's huge, that 80% of the time it can be prevented.
It can, and you have to go to your doctor to figure out what kind of risk factors you have. 9 times out of 10, you can't really tell that you have them. For instance, high blood pressure being controlled. If you have atrial fibrillation, which is an irregular heartbeat, that can lead to it. High cholesterol, which you can't necessarily feel, can do that. Buildup of plaque in the arteries can also do it. So, you know, it's a very preventative thing, and you don't necessarily know if you have any of those unless you get preventative testing.
What's happening when somebody has a stroke? What actually happens to the body?
So what a stroke is it's a lack of blood flow to a brain, and there's 2 different types of stroke. A clot can block the blood flow, or a vessel can burst, causing lots of blood in the brain, so hemorrhagic stroke versus ischemic stroke. So those are the 2 ways that strokes can occur.
And that could lead to really serious and long-term disability for an individual.
Depending on how severe the stroke is, it can lead anything to like a weakness in one arm, to you can't move that arm at all, to speech problems, to bowel and bladder problems, to not being able to communicate. There's tons of things that it can cause, unfortunately.
What types of things can people do in their everyday lifestyle to try to eliminate their risk factor?
Stop smoking. Smoking doubles your risk of stroke. Lose weight. Obesity has been shown to increase your stroke rate. And knowing the signs and symptoms are extremely important. And limiting those risk factors that I mentioned before are paramount to decreasing your risk.
What are some of the warning signs?
So we tell our family members to look for fast. Any facial changes, get your family member to smile, and if one side of your face droops, that's one sign. Get to raise your arms, and if one arm drifts, that can be a sign. Speech, if there's any change in speech, if they're slurring, if they don't make sense, that's another sign. And then you need to call 911 if any of those things occur.
You don't have to have all of them, but if you're smiling and one side of your smile is drooping, that's a sign right there.
Right.
Get help.
Sudden changes. That is sudden.
And as far as the age group that we're talking about, I mean, is it a certain age group, or this could happen to anybody?
Well, depending on your risk factors, it really could happen to anybody. So that's why it's so important to get checked out and learn your risk factors.
All right, Dr. Meredith Maxwell, good, definitely good tips here, because it is Stroke Awareness Month.
It is.
This month. All right, thanks so much.